You've heard me talk many times about my struggles with gut health and how I've been taking a probiotic from seed. Well, digestive issues aren't just for grown-ups. Kids can suffer from it as well. That is why I wanted to pass along a clinical trial participation opportunity in the event that you may have or know of children who experience occasional constipation. Seed is currently recruiting 300 to 500 participants for a clinical trial to study the pediatric gut microbiome and assess their pediatric daily synbiotic, a probiotic and prebiotic formulated with strains that are intended to alleviate gastrointestinal discomfort. Participants will be compensated up to $225. Here's some details about this double-blind study. Children with constipation between the ages of 3 and 17 are eligible to participate. The study duration is 16 weeks. The study is fully remote with no in-person visits. Subjects will provide stool samples at baseline and week 12. Parents or direct relative guardians of study subjects will receive extensive education on the symbiotic use. If you'd like to learn more and or enroll, please go to drdrew.com/trial. That is drdrew.com/trial. On behalf of my friends at Seed, thank you for moving science forward. Hey, everybody.
Hey, everyone. It's good. A dose of Dr. Drew.
Don't let me interrupt, Susan. Thank you, everybody. We appreciate you being here. And Dr. Monica Gandhi, welcome to the program.
Thank you very much.
It is such a privilege to have you here. Let me give you a little bit of Dr. Gandhi's particulars. Professor of Medicine, Associate Division Chief, Division of HIV, Infectious Diseases, and Global Medicine at UCSF, San Francisco General Hospital. She also serves as Medical Director of the HIV Clinic at San Francisco General Hospital. Dr. Gandhi, it is a privilege. You come highly enthusiastically recommended by many of our users. They're so excited to hear your thoughts.
Thank you.
So I want to start with, I've got a ton of stuff I want to get into today, but I want to start with something you got me talking about a little bit before the mics heated up, and that was the public health messaging around COVID. There's so much to be critical of, but let me just frame for you my experience. The reason I'm particularly critical is I too, back in my early part of my career, I was very involved in HIV and AIDS. That was what residents did back then. I mean, that's what internal medicine was, hospital-based medicine was about, 1984, 1985. And one Anthony Fauci back at the time was urging us to get out in the media and educate. He kept saying there are going to be 2 million people dead. We've got to prevent this, 2 million people. And we need to figure out how to get buy-in and how to get people to change their behavior. We didn't go out and say, you're a murderer if you have sex with somebody. We found a whole discipline developed of public health messaging to get buy-in and change behavior. And it included narratives, relatable sources, somebody who was like or the same age or same color as other people, their narrative of the consequences of their choices, a little humor, a little music, and there we go. And that changed behavior. That changed behavior dramatically. And I've done that in many, many different contexts in the media, and it always works. Why did we completely abandon that in this pandemic? Completely. It's unbelievable.
Completely. I completely agree with you. I mean, you're talking about the idea of harm reduction, and you're also talking about the idea of not abstinence-based, shame-based, fear-based, something's wrong with you based messaging.
Well, and by the way, and let me interrupt you and just say, if those things worked, I suspect we might have done that. They just don't work. They really don't work, and they're awful. They're unpleasant awful. And they don't work. So both.
Yeah, they're awful because they make people feel terrible for being human. Yeah. So they make people feel terrible for, in the case of HIV, wanting to have sexual intimacy, and they make people feel terrible for breathing in the context of COVID-19. They make them feel shameful, dirty, something's wrong with them. That
if
they
you
want to
take
be
your mask out, you're going to kill your grandmother. You're going to kill your grandmother if you go outside. It's like, what?
Yes.
Where did that come from?
And we used, and it was weird because we learned really quickly. Actually, we remember how we hated the people who used abstinence-based only messaging in HIV?
Oh, yes.
We made fun of them.
Oh, yes.
We presidents of the United States at the time of the pandemic.
Yep.
We disliked them because we thought that anyone who would make someone feel badly for having an infectious pathogen that has something to do with their life, but that's not who they are, we would hate them if they tried to make someone feel shameful.
Yep.
So somehow now we have billboards to this day that say, stay at home, save lives. And I don't understand it.
And not only that, I was used to the I'm a very super moderate in the middle kind of guy, and I'm a pragmatist, and I just want to help people. But I was used to, back in the HIV days, the pandemic of HIV, that the people on the right were telling us how to live and shame-based. Now the people on the left are telling us how to live and shame-based. It's so weird.
It's so weird because it feels like it's the same people who knew from the get-go that using shame and fear is a terrible way to change human behavior. And we've known that even in the setting of pedagogy and children, all the way up to how people are, that you don't say that there's something wrong with them, that they want to be around other human beings. You say, okay, you mean there's this pathogen that keeps on going on and on and on and on and on, COVID-19? Okay, let me tell you how to stay safe. These are some things that we can do. We can open a window, we can distance, we can mask. Let me tell you this. You want to see your family over Thanksgiving and Christmas? Okay, let me tell you what to do. So what I advise is, like, the two separate families, when they're eating, they're in separate rooms, open a window, wear masks in between. There was so many ways to message that would have allowed people to not be surreptitious about wanting to see one another, which is very human.
Right. And it was the lack of information. They weren't actually informing people, like, yes, your grandmother is at higher risk than your 12-year-old. It's like there's a difference there, and maybe the risks need to be managed differently. The other thing that I found astonishing is the biggest problem. Well, maybe I should watch my language. One of the biggest problems with this pandemic is overwhelming the hospital system. And there's lots of information that could be provided to people to help keep them out of the hospital. I went on Instagram Live when I got COVID, and I said, look, I do telemedicine with my doctor. I don't have to expose anybody else. I have this thing called bamlanivimab, and it stabilized me and kept me out of the hospital. It's available to you, and it's free to most people. So the bamlanivimab and some Decadron, talk to your doctor about this. No one was discussing how to stay out of the hospital. In fact, no one was telling sick people anything.
Yeah, there something went wrong. Okay, so I think of any pathogen in terms of prevention and treatment.
Yeah.
Right. So HIV, we didn't have treatments at the beginning. So then we messaged a lot about prevention, including condoms. And then luckily we got into PrEP and treatment is prevention in other ways. And then there was treatment when antiretroviral treatment came out. And then we talked a lot about treatment. Yeah. Here, we are talking about, we have two ways to prevent. Now we're lucky enough to have vaccines, which are the ultimate way to prevent.
And some treatment prevent. Yeah. Well, actually, some of the treatment stuff is preventative too now, with Regeneron looking like a prophylaxis.
And then we had, so that's a very fair point. And then we have treatments, which, it's really interesting because there's some early evidence for tenofovir being a treatment to keep you out of the hospital, but we didn't explore that enough. There's treatment. We ended up just sort of not, I guess you're right. We waited until people had severe disease and then talked about treatment. Yeah. And then the one thing we didn't do is the way we talked about prevention was not nuanced. And I think going back to what you and I were saying, it's not nuanced. It's actually very easy to say, if this, then that. Yeah. And instead, we just said, it's all this. It's all blunt lockdown, as if it was radioactive, which it's not a radioactive virus like in the movies.
Well, and what was weird to me, and what caused me to get so aggressive in the beginning of this pandemic, and I got some things wrong because of it, was it seemed to be modeled after something invented by General Secretary Xi. I don't know of that ever having been done before in human history until the Chinese Communist Party did what they did. And I'm not sure what they were doing or what they were intending to do, because it wasn't doctors, it wasn't public health officials. I just kept saying, listen to the public health officials, listen to Dr. Gandhi, listen to Dr. Fauci, let them do their job. But it just ran away. And every standard became what the Chinese Communist Party was doing, which was a bizarre standard to me. Am I wrong?
To me, it actually didn't feel like that. I felt more like abstinence only at the beginning of the HIV pandemic. And I can't get it out of my head that was the most cruel thing you could say to a young man who would be at risk for something, is say, you may never have sex again. You may never. Like, that's something wrong with you, so you can't.
Yeah, and you can't. If you do, you're a murderer. Which is we added that on this time. You're killing your grandmother. You're a murderer. You're killing people.
Yeah.
I feel like one part of me feels like, oh my God, I know we've had a narcissistic turn in this country, but now I think we've had a histrionic turn. Now we've
I think that's a very good point, because I was on a program with two other people who I think are trying to message more nuanced ways, and one is Stefan Baral, and both of us said, you know, when you get accused on Twitter or another medium of wanting to kill people by, you know, for example, opening schools, thinking that schools are safe places for children to be, when you get that word that you want dead children, or you want dead humans, or you want dead old people, you have just completely broken down any attempt at dialogue, because you've just accused another human being, in this case doctors, but it doesn't matter who you're accusing, another human being of wanting another human being dead. And then that has taken away any ability to have a dialogue.
Not only is there no discourse there, the insanity is that then becomes truth that is reported by the mainstream media. That falsity is then reported as truth. And that becomes the spin, that you want to kill people. And that's hysterics. That is histrionic. It's really, woo, I've never imagined I would live in a time like this. But
we have a lot to dissect about this later, about this pandemic. There will be many books written, I think, about
I hope so. I hope
how we didn't message kindly and compassionately.
There needs to be some serious apologies. And instead of, you know, confident, clear, nuanced messaging, here in Los Angeles, what we got is, there are people dying. Do you know there are people? Imagine if you sit at the head of a bed like crying because somebody has a serious illness. Pandemics suck. They're horrible. People die. They suck. I can't say that enough. But to pretend one death is too many and we should be able to prevent any death, again, histrionic. That's histrionic.
There's something that went wrong with our response here. And I think it's political. I think it's politicization on both sides. And I think that the way I think about this pandemic is actually all you have to do is look at the data. And if you look at the data and you report in a clear-eyed manner about the data. So a good example is what's going on with B117 and children and Michigan and all of that.
Yes, tell us about that. I was going to ask you about that. Tell us about that.
Yeah, you just have to look cleanly at publicly available databases.
And what do you see?
Which are by the CDC.
What do you see?
And you can see that hospitalizations are not increasing among young people, children in Michigan. And you actually just can map it out because they have these data sheets and they have these medical thing, you know, they have publicly available data. And actually, I think that it's increasing there, likely because of B117, partially also because of not too much natural immunity, and also the vaccines aren't going out fast enough. But there is this bizarre turn that it's children.
You should say that again, because that's a really important, you're saying something clear and distinct that no one is saying. It's that they had never had much outbreak in the first place, so they're getting their surge now. There is inadequate vaccine. And what was the third?
And the third is that B117, I think, is more transmissible as a variant. But I don't, well, it's not even that I don't think, it's not more virulent. Actually, luckily, there was 2 papers yesterday from the Lancet, one in Lancet Public Health and one in Lancet ID, that did a very careful analysis in England at the time when there was both B117 and the ancestral strain, and showed that B117 isn't associated with more severe symptoms. So when you have more cases in an area, by definition, you're going to have more hospitalizations, but that isn't luckily disproportionately happening in children, nor do children seem to be spreading it disproportionately. They spread it in the same way that they always have, which is less than adults. And again, that is just publicly available data. We're putting that together now and submitting it in the next day or so. And so this is how I've chosen to take an approach to this pandemic, which is different, and it's gotten me in trouble at times, is I don't actually believe in party lines, because HIV, if you believed in party lines, then it would have made me a not compassionate person at the beginning, at times during the HIV pandemic. And I sit and talk to patients all the time. Like, that's actually my true role, or my true identity is as a clinician and talking to other human beings. So I think that informs me differently than if I wasn't a doctor. And by doing so, I just try to look at data dispassionately. For example, I was a big proponent of masks. And now I'm talking about when masks should come off, and when mask mandates should be released. And that is confusing people so much, because they're like, hey, here's Miss Mask, and now she wants mask mandates to be released, which I do. And I have a very specific metric and date in mind. So if you look dispassionately at things and don't get over committed to something and just keep on looking at the data, I know you can message clearly in a pandemic.
That was the way we always did it. That was when the medical system would look to people like you and the CDC, and then we would do our job. But that's all been taken away in some weird way by governors, and I don't even know who anymore. We should have been listening to you and the CDC from the beginning. That's who should guide us through a pandemic.
Yeah. It got political, but it got political on both sides.
Oh, I know. I'm not blaming a particular thing. I'm just astonished that people don't understand that this was a medical problem that the medical system and professionals are geared to manage. And we would have had disagreements amongst ourselves, as we always do, and we would have hammered those disagreements out and come up with a consensus. And we would have, H1N1. That's what happened. And most people aren't even aware H1N1 happened. And that was a major pandemic.
You're right that this became attached to, I don't know, party lines and whether you were right or left, and Trump said this, and so we had to say this, and Trump said unreasonable things, but then he said one reasonable thing, which is that schools should be opened. Yep. And then we didn't work hard enough on opening schools because he had said schools should be opened.
Exactly.
And then what happened is that we are sitting here now, and it's literally April 13th, and the schools in San Francisco just opened yesterday, and it was only for part-time, and it's only for young children. And we are in a state, you and I, California, that has the lowest rates of school openings, along with Oregon and Maryland. So the
effects of this will be profound.
I think they will be profound for children.
Yeah.
I think they will be
profound. I mean, I have psychiatrist friends that work up in and around San Francisco General, and they're seeing, some of them are child psychiatrists, and they just say anxiety, depression, drugs, alcohol, anxiety, depression.
We have a clinician here who's been speaking very vocally, Dr. Jean Noble, who's the head of the ER COVID response, and all she's doing is saying how many suicidal ideations she's seeing come into the ER, and she is panicked about the impact of school closures on mental health, obesity, even increasing rates of diabetes, depression, isolation, anger. It is children need children. Like Steph Farrell said it, the most simple tweet one day. He said, kids need kids. That's the tweet.
And back to your mass date. You want to tell us what you're thinking there in terms of your provisional?
Yes.
Yeah.
I have a very clear metric. Okay. And actually, again, I'm just passionately looking at data. And I am someone who, along with my division chief, we wrote one of the first papers on masks that you can find in this country. It was actually, we wrote it before the CDC recommended masks on April 3rd. We called it Universal Masking. The time for universal masking of the public is now. And it was published in OFID, but we actually, as we were writing it, the CDC recommended it. And then the editor of OFID said, oh, you should change it. The CDC said it. So we really wrote one of these first papers. So do believe in universal masking during a public health emergency of this sort. However, now we're getting through the public health emergency, and we have vaccines, and we're really lucky to have these vaccines. And these vaccines are profoundly amazing, and they work incredibly well, and they're safe and effective. And beyond that, the US, after a sluggish start, even at the beginning of the Biden administration, lots of things happened, and vaccines are getting out. Now 3 to 4 million doses being given a day. Yeah. Okay, so we're in this state where April 15th, the entire state of California opens for vaccines. Yes. And let's just stick with California for a minute. I think that the mask mandate should be lifted in the state of California on the day after everyone who wants a vaccine can get a vaccine. And April 16th, 15th, if we open it up, that's going to take about 2 months. Okay. And it turns out the mask mandate was put on in California on June 18th of 2020. So I have this very round number in my mind, like an anniversary, that the mask mandate should be lifted in California on June 18th, 2021.
Are you getting, is Dr. Galley consulting with your department or to make these sorts of decisions?
I did actually recommend this to the California DPH. I have made that recommendation and I gave my reasoning, and I put it also publicly in Twitter. And my reasoning is super simple. It's that everyone who's vaccinated will be protected. They will protect others by being vaccinated because those who are vaccinated, it's very hard to transmit COVID-19. We have enough data on that now. The third is that those under 16 who can't get vaccinated yet until the EUA goes through for the 12 to 15-year-olds, what we saw in Israel is that by vaccinating over 16, there was a paper in medRxiv just 2 days ago that shows us that the rate, for any 20-point increase in adult vaccination over 16, you half the rate of any child getting, the children getting COVID-19, because by definition, you stop transmission to children. And finally, if someone declines to take a vaccine, they can wear a mask if they'd like, but a mandate has to be based on a public health emergency. And once you're vaccinated and you protect others by being vaccinated, that's no longer an emergency. I think it can be recommended. I think people can still wear masks indoors if they'd like, but it's not a mandate, not a mandate.
Do you know, is it Larry Brilliant, the smallpox researcher? He was saying that he's been through many, many pandemics around the world. He goes, you don't have to mandate anything. People adjust their behavior based on their risk assessment. People get it together. I mean, if we're not stupid, you give them the information and they adjust. It's not the job of the government to tell them to cower in place. My God, what prompted that? My God, that was the strangest thing.
So in this case, we actually have a mandate. So it's not even a recommendation. We do have a mandate in the state of California. And I have a very clear, clear-eyed metric of when that mandate should be
the California Department of Health has not been responding to data. They were presented with data about outdoor dining, and their response was, I need people to stop moving around. We had to do something. I don't know about you, but when my residents say we had to do something, I yell at them because that's how you hurt people. Doing something is how you create iatrogenesis.
I agree with outdoor dining. I actually spoke out about that in December because my fear of outdoor dining closure was that then where people would go would be inside. And there's just simply no doubt that inside is less safe than outside, and
it's where it transmits.
Inside behavior.
Inside the home is where it transmits. I transmitted one person, my son, in the home. That's it. That was my transmission.
And you still have a Twitter account? Household. How does that work? Like, how did
Dr.
you say?
Gandhi?
Yeah.
You mean being able to say these things and not get crushed?
Yeah, good for you.
Well, yeah, I say stuff like that, and I get called a murderer and all that stuff. So it's good times.
But I did say it, and actually, it was really hard to say it in a way because I really respect my colleagues, and I grew up here. I really grew up in California. So I've been a resident at UCSF in 1996. So I know very well the people at all these departments of public health. And it was actually really hard to speak out and say that. I have to admit to you, it was profoundly hard. And I have had 2 low days during this pandemic. One was watching New York at the very beginning of the pandemic. It was a very low day, and I couldn't move for a day. And I wanted to go there. And the second day was actually feeling that I was against people who I really respected by trying to provide a more nuanced harm reductionist perspective.
Again, since when are doctors in an ad hominem manner against each other?
And it surprised me.
It surprised me
because I'm in a city that is a very harm reductionist city usually. Like San Francisco is a very, I think, wrote the book on HIV harm reduction. So it surprised me to live in a city where I thought was nuanced and harm reductionist and be the harm reductionist of the city and have a lot of others be more locked down.
Well, again, it was why they would attack you as a person. Why you weren't attacking your colleagues as people. You were doing what we do, which is that we go at each other's positions and we intellectually try to bring each other closer to the truth or to what's better for patients. Again, abandoned during this epidemic. Weirdly.
Something went wrong during this epidemic.
Yes, it did. Yes, it did. I think that pretty much says it all. Something went wrong. I totally agree with you. And it is the the injection of politics into this, and there's no one really to blame for that, I don't think. Let me take a minute and go to vaccines specifically now. So Johnson & Johnson was halted today for, I think, 7 cases in women aged 16 to 48 or something, 6 to 14 days after the vaccine, where there was some blood clots, and they're looking at whether or not this was related to birth control pills. Am I essentially summarizing that accurately?
Yeah, it was 6 out of 6.8 million doses given, and they were between 18 and 48, and you're right, they were all women. And it was a serious blood clot, cerebral sinus venous thrombosis, and but it was very, very rare.
Right.
And when there's only 6 people, you do have the opportunity to say, okay, we should make sure that there's not oral contraceptives involved or other clotting disorders, and that should take very little time to figure that out.
So let me bring this closer to home a little bit for you, and I don't mean to put you on the spot, but this will be an interesting little experience here. So I had the J&J vaccine on Thursday. We're now Wednesday. Had a nasty reaction. I'm also post-COVID with high antibody levels, but we want to travel, and so I just said I'll take the vaccine. I do not want this thing again, and I would like to be extra protected against the variants. I did figure I'd have a reaction, so I thought I'll just take J&J since I can do it once and not have 2 reactions and feel bad twice. So I took J&J.
That was a good idea.
Felt terrible, had 2 bad days, and was fine, but woke up on day 3. I don't know if you can see this. And can you see what's going on in my eye with spontaneous ecchymosis, spontaneous raccoon eye in my right eye,
today,
which is a sign of a transverse sinus thrombosis. So I'm assuming that this is just a coincidence and that I don't have a transverse sinus thrombosis. But
I think so.
But it's beyond crazy little coincidence here. When I have seen, personally, when I've clinically seen transverse sinus thrombosis, it's like a moon rock hitting in the backyard, but I've seen a couple. And one was, it presented as paralysis of the spinal accessory nerve on that side, because the 11th third goes through the sinus.
Now you can see his eye for sure.
And he had a flail scapula, came in with a flail scapula, and that was the presenting features. And then Hillary Clinton, she presented with ophthalmoplegia because she had a stroke, which often goes with the transverse sinus thrombosis, which I've been watching my eyes very carefully for the last 24 hours.
Oh, no, I think it isn't anything scary, but that certainly must have felt weird this morning.
It felt very weird because I was ignoring it. I was ignoring it like whatever. And I thought it could be related to the vaccine, kind of interesting, whatever.
I brought that up. I was like, you just got the
vaccine. It occurred to me. And then this stuff came up this morning. I'm like, oh, no. so here we are. But
you're gonna be fine, but just stay quiet.
Yeah, when I take aspirin every day, but talk about, well, staying quiet's hard for me. But talk to me about the antiphospholipid syndrome, or the antiphospholipids and clotting in COVID and the vaccine. Do we really know? Because my patients that have antiphospholipid chronically who got COVID died fast. It was terrible.
So this was published in the New England Journal last week, and the idea here is not actually around specifically the clotting disorder that occurs with COVID, but with the vaccine, there's a question if either the adenovirus or the DNA itself triggers an antibody, an antiplatelet antibody, the exact same antiplatelet antibody that we get with heparin, that can cause, heparin-induced thrombocytopenia. And so the question is, it's called vaccine immune thrombocytopenia. And could the vaccine, either the DNA or the adenovirus, which is interesting, of course, because both AstraZeneca and the Johnson & Johnson vaccine have this DNA, have DNA inside an adenovirus, inside another virus. That was a postulated mechanism. It was 11 people that they looked at in the New England Journal study published last week. But it does lend some weight to the fact that AstraZeneca also had 222 clots in many more people. The rate is still very low. It's the way I keep on thinking of it to myself is it's 6 zeros and then a 6. So point
that data is exactly why I'm not worried
for
about
AstraZeneca.
This is much more likely to be something coincidental than an actual clot.
And also the proclivity in women, which also occurred with the AstraZeneca clots. So it was more in women, and it was all women. It was all people less than 55. So what the EU decided which I don't think is unreasonable, is we're going to give the AstraZeneca, because we need to give the AstraZeneca. We have bad pandemics and we don't have enough vaccine. We're going to give it, but we're going to give it to older individuals. We're going to give it to 60-year-olds.
Where this has not been observed. And by the way, I'm in that category too. So it makes it even less likely this is really something.
So that is not, I can guarantee you, and I'm a very optimistic clinician, 99.9999999% that is not
Yes, I would think so. I have no headache. I'm fine. It's all good. It just be too weird if it were. Yeah, too weird.
And you have no headache.
Nothing.
Or
Zero. Zippo. Nothing.
Thank you.
But he did have COVID already, so who knows?
Yeah.
Yeah, and I mean that's the thing, that having COVID itself is such a boost to your immune system.
Yeah.
I also, like you, sort of really puzzled over it and came up with a recommendation that I put on Twitter that anyone who's had COVID should get 1 dose of a vaccine. And I got some pushback on it because they were like, is this more your feeling? And I said, you know what? I'm going to admit it. It's more of my feeling. It's more that I don't want anyone to ever get COVID again. I hate COVID. These are great vaccines. I think 1 dose is safe. There's been evidence that if you've had COVID with the 2-dose vaccines, you can just get 1 dose and you had such a boost from getting COVID, then the second dose is like your first dose is like your second dose. Yeah. So I would have done the same thing that you did, which if I had COVID in the past, that I would have taken.
And there is an emotional piece in the patient too. It's not just your feeling. Yeah. Let me tell you, somebody when it came on again in reaction to the vaccine, I'm like, I can't do this again. I'm tired of this. And
it's awful.
And it passed.
COVID's awful.
Yeah, it's a beast. It's a beast.
Yeah. It's a beast.
And the morbidity is not talked about enough. People get very focused on the mortality, which is, of course, important, but the morbidity is really something. I had the whole long hauler
thing. It's a terrible virus, and I want the vaccines to take it away, and they will. I really can't explain to you how convinced I am about the power of the vaccine.
By take it away, do you mean it will never be an endemic virus again, or will take it away as a significant risk factor in the population?
It will take it away as a significant risk factor. Yeah. So this is how I think of it. If you've defanged, I keep on using this word defanged, if you've taken out all the teeth in a virus, so if you have 100% of people who get the vaccine don't get severe disease, if you take 100% of people and they don't get hospitalized with COVID, that's amazing. Yeah. And that's actually how high the efficacy and the effectiveness of the vaccines are. Right. Efficacy meaning what happened in the clinical trials, effectiveness meaning what happens in the real world. And then you get very few people who get mild COVID, which can happen with the vaccines. Yeah. Then you bring down the cases in the population to a very low rumble, because that's what vaccines do as well. And that's what vaccines that reduce transmission do as well. I think you're going to have some COVID in the future. I think that there are going to be people who decline to vaccinate. I think there are going to be people who come in the wintertime and we're going to swab them for RSV, for flu, for COVID, for, other viruses. Next. And then we're going to go down this pathway. If they have flu, you get Tamiflu, you get remdesivir and steroids. If you have COVID, you get, ribavirin if you're a child and you have RSV. I mean, we will stratify people accordingly. But it will never be like this when you get enough of the vaccine populated and you keep your cases extremely
There's an article in April 6 JAMA, The Potential Future of COVID-19, Will SARS-CoV-2 Become a Recurrent Seasonal Infection, which is what we're talking about.
Yes, but it will be low level. It will be low level if we can convince enough people to get the vaccine.
I don't know if you've looked at that Merck product, the oral antiviral that essentially, I think it's a reverse transcriptase inhibitor or something. And to me, if we get something like that, we're
Previr. I had to pronounce it right.
Yeah. Malinavir. Malinavir is the name, something like that.
Anyway, no, okay, we're both getting it wrong.
Yeah. Anyway, it's that something like that.
Yeah.
If we have something like that, well, then this thing becomes a nothing.
Yes. Yeah. Yes. Exactly. Yeah. And so if we had better treatments for outpatient COVID, that would also then, anytime you get a mild case, you pop your medication and that's only few people are going to get it, because we are going to get it down to a very, very low level. That's what, measles is not eradicated, right? Measles, actually polio isn't even eradicated, which we thought we would have by now, but measles is not eradicated. But I am an infectious disease doctor, and I have seen measles in my lifetime that I've treated, and it's been very, very rare.
Hang on a second. My stream is straightening us out. Molnupiravir.
Thank you.
Molnupiravir. we put both what we were saying together. You get molnupiravir. That's what.
Yeah, when we combine them.
Let's see. I think. Did I get everything I would? Oh. So I don't think we flushed out. I'm going to let you go in just about 2 minutes because I know you've got to get to another lecture. But we've danced around the variants a little bit. Talk a little more explicitly about your optimism for B1351 and P1. Because those are the ones, as a COVID survivor, those are the ones that I don't want it. I don't want those, but I feel like I'm a little vulnerable. So go ahead.
So B1351 being that South Africa one and the P1 being the Brazil one. So, the way that I think of all the variants, including those two, is I keep on keeping my mind focused on two important papers and what I learned from Dr. Abul Abbas at Harvard Medical School when I was literally a first-year medical student, which is that T cells are the main arm of the immune system that fight viruses, period. And why would I be so acutely aware of that as an HIV doctor? Because HIV affects T cells and people get severe viral infections. So when I think about you and your T cells, these two papers that are so important to me, one is by Dr. Sethi and one is by Dr. Red. And Dr. Fauci talked about the Dr. Red article at the White House Task Force meeting 2 weeks ago now, that showed that you have such a complex T cell response across the entire spike protein. You basically have multiple epitopes across the entire spike protein that you personally made CD4 and CD8 cells to. And so what Dr. Sethi's article showed is that if you put your blood or vaccinated blood, people who've gotten the mRNA vaccine, in a test tube with all the variants, your antibodies may be a little lower against the B1351, but your T cell response is perfect, absolutely neutralizes and gets the B1351, the P1, the California variant, and the B117. Those are the four that you look at.
Is that just for the COVID survivors, or is that also the vaccine group? Both.
No, Dr. Red's article was for COVID survivors, Dr. Sethi's article was for people who've gotten the vaccine.
So then would we call the Israeli data from a couple of days ago just sort of epidemiological, strictly?
Yes. So the Israeli data from a couple of days ago was, people hadn't gotten their second dose of the mRNA vaccine, and there were a couple of breakthroughs, the B1351. And then in addition, there were people, they didn't tell us if they were asymptomatic, which is what T cells do for you. They fight infection so that you actually wouldn't have known if they weren't swabbing them. And they also didn't tell us something super important. What was the viral load of their swab in their nose? Were they actually infectious? Or did they get a B1351 in there? Your T cells and your antibodies, everyone comes swooping in, they try to kill it.
See, I assume they're swabbing sick people, that we don't know they're swabbing. They didn't say that, right?
No, they didn't say it in the paper. I actually looked at it closely. And so this is just a medRxiv, a preprint. And the peer review paper better tell us what the viral loads were of those people so that we can see if they were true infections. If they're not infectious and they didn't make anyone sick, I call that a tree falling in the forest. If you're asymptomatic and you can't and you can't pass it on to others, then that's not an infection. That's the oversensitivity of a PCR test.
Okay, Dr. Gandhi, I feel like we've run the cycle, as they say. I'm looking at my notes to see if there's anything else I was hoping to get to, but I think we covered it. I'm looking at my restream here to see if anybody has any lasting questions for you before I let you go. Do you feel that we've missed any? I feel like we've sort of...
I just want to say that having nuanced, complex, tiered messaging is really okay because the public is not dumb. And there is something that in this nation where we say things like just say no, instead of saying, it's really complicated if you've had an addicted parent and you're tempted by drugs. And so let me explain to you, we just tend to use sound bites like stay at home or just say no. But I know that after this, we can learn to have more nuanced, complex messaging, just like you and I do when we're standing in front of a patient.
I guess my last question would be, so I took fluvoxamine when I was in my long hauler syndrome, and it worked like crazy. N of one, maybe, you know what I mean? But I will tell you, 30 minutes after I took my first dose, I had terrible tinnitus from my long hauler. It went away. 30 minutes after fluvoxamine. And it turns out, but it came back, to be fair, but it was at a much lower level. And it turns out I've had my VEGF, I've had all my cytokines measured. My VEGF is off, which is the cytoinflammatory medium. And it connects to the sigma-1 system, which is what the fluvoxamine stimulates, which is kind of all interesting if it's real. But interestingly, if you mention fluvoxamine, just mentioning it today may get this stream canceled by YouTube.
Okay, that's okay, because I'm now going to give fluvoxamine to my patient who has long haul syndrome, because you just told me, and I do believe in the evidence that you just told me.
I took a,
and
there's a ton of evidence out there. I took 100 twice a day. It's all I took. I had no side, was not even aware I was taking it, but I just started getting better, and I was better in 2 weeks on it.
Okay, and that makes me so happy for my patient.
Yeah, lots of stuff out there on that. Be that as it may, the tendency for us to be silenced in any of our public discourse about the landscape of treatment for COVID is another bizarre aspect of what's going on right now, is it not?
It is, though. I do know, and whenever I get upset about that or upset about anything about COVID, I keep on thinking, you had to look yourself in the mirror when you, like in 2 years. And so when I was like pushing through with saying the outdoor dining or harm reduction or don't make people feel shameful or fearful, I keep on thinking, I know I'm going to be right in 2 years. And I know that we're going to look back on this time and do lots of postmortems of this time and think it was awful. So I promise that all of this is going to get better. Well, and any nuanced messaging is going to be the right approach.
I completely agree with you. Unfortunately, the unfortunate part is no one will ever apologize to you for what they put you through to
Okay, but I apologize to you and you can apologize.
Okay, I apologize.
I'm sorry for anything you've been through.
I'm sorry for that. Yes, let's support each other through this.
But come back soon. We want to talk again.
Yeah, good luck in your next interview. This has been a great little sort of survey of the scene. I feel better about my little vaccine reaction, if that's what it was.
You're going to be fine. You're going to be fine. You're going to be fine. Don't take birth control pills.
Yeah, I will not. I don't take any hormones or anything. So I think I'm going to be good. I'll keep taking I'm taking my aspirin. I'll stay with that, I suppose. Or I take a baby aspirin.
Yes.
Yeah, why not? I mean, I have a little bit of a metabolic syndrome, and I have Lynch syndrome also.
The only issue is that it actually causes thrombocytopenia.
I know, and bleeding.
So you know what? Can I just say something? Just hold off on the aspirin for 2 weeks.
Okay, I'm watching for petechiae. I'm watching, my nail beds and everything.
He's an eye picker.
I'm doing all the right stuff.
You're a doctor.
He's an eye picker.
So, but yes, I will withhold the aspirin for 2 days.
Cut your fingernails at night.
Done.
Yeah, hold the aspirin for a few days.
Done.
I actually want you to do
done.
Okay.
And to be fair, this is a bleeding problem, not a clotting problem. So in all probability, but
thrombocytopenia too in that New England Journal paper. So that's why I don't want you to take it.
I know. Okay. I'm quite aware of it. So.
Okay, thank you.
Great to talk to you. Thank you so much.
Thanks again.
Okay, thank you.
Dr. Gandhi,
we'll see you soon.
Okay,
see you soon.
Bye.
Now it's just me and the restream. So that was good. Andrew Ashkazvili, thank you so much for bringing her in. I mean, that is a peer who is a clear, dispassionate thinker that should make everybody feel better. She is saying open everything by June 18th. I'm going to put it on my calendar. I think June 18th would be a great day to undo the mask mandate. I mean, we have to do it somewhere. And it seems like, again, this politicization is all about just continuing this going forever, which is a horrible mistake.
Hey, Andrew, who's next?
Andrew, yes. Who would you like next? This was a good one. Let's see who's on here. Tom Segar got in a bar fight. Woof. Oh, no, I got in a bar fight.
Oh, you did?
Oh, that's what it looks like.
Somebody said...
Tom Segar, I don't know if you're old enough to remember, I'd rather fight than switch. Mm-hmm. But that's look that up on YouTube, and you'll see a whole series of tobacco commercials.
Oh, that's so funny.
Yeah.
She was lovely.
Oh, my gosh. So clear, so thoughtful. I mean, this was... When I talked to her, it reminds me of exactly what I wanted back when this whole pandemic was opening up. This is when I was saying, shut up to the press, stop it, stop your BS, I was thinking about peers like her and that they're the ones that people should be listening to. And wouldn't this have been a much better, oh my God. I mean, there would have been no shutdown. There would have been no school closures. There would have been probably less deaths. There would have been less misery and destruction and less jobs lost. It just goes on and on how much better it would have been. So there we are. That's us. Andrew, I don't see you on the thread here. Did you not stay with us through the entire interview?
Who?
Andrew Ashkazvili.
Oh, he's drinking. He's so proud of himself.
Oh, he's drinking. Did you see him?
Some kind of whiskey.
Okay, somebody is saying Dr. Agus, sure. Dr. Ashish, yeah. I don't know who that is. More about
Leopold Prosky keeps saying, Dr. Drew, I had a severe reaction the first Pfizer shot.
Not surprising.
Same brain dream issues that I haven't had since COVID.
Yep, me too.
I'm convinced the spike proteins affect neurons and synapses.
Me too. Well, or the antibodies in response to the spike protein. There's really something very protein and unique about our body's response to these spike proteins. I totally agree with that. But I want you, Leopold, to tell me, I'll watch for it on the stream here. It wasn't as bad, though. You know what I mean? When you're in the COVID, you really feel like, oh, I'm not going to make this. Now this was just, oh, crap, here we go again. But it wasn't that same kind of relentless, how am I going to get through this kind of thing that I felt during the COVID.
Anthony Brown says, don't complain about my meatloaf.
Rex is here. It's time. It's 4 o'clock. Rex came running in. Joe Giannotti, what was the data? Oh, there's Andrew.
Oh, I've got it.
June 18th. We as humans need a goal to hit. That's right. Deadline dates. We can tolerate more discomfort. We know how long we're going to have to tolerate it. That's a psychological fact about humans. Wish all health officials would give us messaging with dates. Yes, Andrew. I wish all health officials would give us nuanced, honest messaging like
here's the latest Michigan data.
Oh, it's jumped back up again, but no hospitalizations, though, Joe. Isn't that right? Or no dramatic increase in hospitalization. Somebody can tell me
Here's
that.
his new Michigan data. It's on the screen.
Is there hospitalization in there? Do you have that?
I don't know why it's not getting bigger. Oh, shoot.
That's okay. We can see it's bad.
Oh, no. Oops. Oops.
Leopold, mine were severe, really PTSD kind of experience. That's exactly what mine was, kind of a PTSD thing. So, yeah, and that's why I took the Johnson & Johnson. I didn't want to go through that twice. I knew I'd have a reaction.
Okay, here we go.
Now, you got to think long and hard and talk to your doctor about whether you want to take a second vaccine.
Okay,
so
it's
there
not
we go.
doing the whole picture. Let me make this smaller. I'm going to put this. He works long and hard on these graphs, so we should show them.
I agree.
Okay, here we go. Here we go.
There is Michigan.
Go, Michigan, go.
It just keeps going, and it's, again, as Dr. Gandhi pointed out, mediated by young people, but it's not,
so that was
getting hospitalized and not spreading it.
This is the ICUs average.
Oh, well, that's hospitalization, that's for sure.
And then this is the deaths.
So deaths are going up a little bit, as they must. Hopefully it will plateau here.
These are the 7-day average.
Joe, do you want to give us your thoughts on what you think you're seeing here, or what we think we're seeing? I'm looking for Joe. Major issue with data. I need to explain.
New positive cases. Check that out.
Joe, I'm not taking calls today. Maybe tomorrow we can go through the discussion about the data.
Yeah, we could.
Calls tomorrow, right? Okay. So, Joe, are you going to look for? You can give me a little message either on Twitter or locals, whichever you please.
I had kind of a theory about Michigan.
Yeah.
Well, because I'm a travel agent, a lot of people are traveling again, and airports are packed, like New York and L.A. and O'Hare. I would imagine that there might be a lot of influx of visitors who have been traveling,
like
or
international
people
travel?
that live there that have been traveling. I don't know. I just feel like
if I lived in Michigan, I go to the Detroit airport. That's a nice airport.
Yeah.
There's parts of it are nice.
Well, I don't know.
And by the way, if you live in the UP or the upper part of the Michigan, that's way far from Chicago. Way far. It's an airplane ride away.
All right, maybe I'm wrong.
But it could be the fact that international travelers come back to.
Do they go through Detroit?
To O'Hare and Detroit, I guess.
I don't know if they go to Detroit as much as they do.
Yes, it was Crepe Suzette, a Territon commercial. Joe was saying the numbers could actually be going down. Oh boy! So Phil Kerpen is correcting Joe. So let's not put too much on that data to a chance to work it through. Okay.
All right.
So we'll have
back to the chat.
This should make you come in tomorrow to see these numbers. We have a guest tomorrow as well.
No, it's called Ask Dr. Drew, and we're gonna Ask Dr. Drew's gonna be
phones.
Ask Dr. Drew.
We'll do phones, which will be great.
And we're gonna ask Dr. Drew whatever you want. So I don't think we're gonna do phones though. I think it's going to be through Clubhouse or Instagram Live, depending on what we want.
Say that again.
I like the Clubhouse and the Instagram Live calls.
Oh, we can get Instagram Live in here. Okay.
Yeah, I mean, we could do both, but the Clubhouse questions, as long as they don't turn into the Steve Kerr show.
That was a rabbit hole we went down. But I was sort of happy to go down it.
Oh, he's a good guy, and I'm glad we got that information out yesterday.
Andrew Rashkashvili, you are so correct. How do we do that? He's saying, I wish there were new public health voices in front of the American people. It'd be refreshing, and it would be honest, and it would be, I mean, just put Gandhi out there. I mean, isn't that just reassuring? Isn't she a reassuring voice? The way she thinks and talks
she
about
is. She's a lovely woman.
Yeah, and that's who should have been directing this whole thing in the first place.
Yeah, I wish she was the Southern L.A. County health official.
Yeah, Tom Cigar says she didn't talk about feelings. She's too rational. We can't have that. So, yeah. Mm-hmm.
I know. It's been such a tough ride for everyone. And then Drew's got a black eye.
Yeah, well, I plan to get through this particular little whatever it is.
I don't take any asprin for a couple days.
Yep, that's what I'm going to do. I took her recommendations.
Maybe you should take that arnica, like I told you.
Yeah, maybe I should. Not a bad idea in retrospect. Okay, so should we wrap things up, or do you want to do something else? Anybody have any other questions? I think we're just about there.
Let's talk about TikTok with Christina P.
I'm not jealous that he's going to take you away. I'm jealous that you get to have a relationship with him. Mm-hmm. He sends you out greetings. I'm the one that responds to them.
You're on the talk now, too. You know the way to my heart. You just have to start producing.
Terrible shit.
Come on. Take a dump on TikTok.
That is the only after this.
Jealous Genes with Christina P.
Yep, that is After Dark. I wondered what you were laughing at. I heard you out here.
Oh, there's a cute one too. This is pretty funny.
All right.
When I cough, I pee out most of the time.
And you can keep pushes that pelvic floor down further, and maybe over a long period of time, maybe. But if you do your Kegels, that goes against that, right?
I'm doing them right now.
Yeah, do some Kegels. Great. Polite applause. Congratulations. Is that what you were laughing at?
She's so dramatic.
I know, ridiculous.
I'm doing my Kegels right now, too.
Congratulations. I will give you the same little polite applause. I'm so proud of you. Okay, thank you, LG Health.
And I got the right link for the, Casey put up the thing, but it's...
Hey, I like where Tom Cigar is going.
Drdrew.com/rational revolution, all lowercase instead of caps like I did.
Put the mugs up there.
That's
again,
the
maybe.
mug. Yeah, it's just it. It wasn't going through. I've been promoting it. Yeah, I have it right here.
Here we go. There it is. Look at that.
Go. Drdrew.com.
That is classic Soviet era imagery.
All lowercase.
Advocating our return to rationality. It was very important to both of us, and somebody came up with that and sent it to us.
It was Chris. You've got to applaud down there. Anyways, if you want to get the mug, they're still available. So while supplies last, check it out.
So Tom Cigar is going in an interesting direction right now. He says we should name this Dr. Drew Strikes Back. Drew Strikes Back.
Okay.
Yeah, I like the direction that's going because I think it's kind of how I'm feeling. So, Tom, tell me more.
Well, we can.
What?
Okay.
What?
Tom, you want to produce a show?
Oh, no. I don't think that's what he's saying. He's saying just thematically.
Oh, put that on the.
No. That we maybe on social media or something. Strike out for critical thought and moderation. That's right. I like this. I like the direction you guys are taking this.
Well,
Can we try that on Twitter? And we asked another question today. It'll be interesting to see if people freak out.
You did? Okay. Let me see.
Yes.
We have a new social media account manager. So I like him. He's a good guy. He's a good guy.
You're talking about Jordan.
At least this time I didn't have to take shit for my tweet. Okay. It's actually really awesome to not be the one. I always make typos, and then people go, "Oh, you're so dumb. You made typos." Yeah. And then I take it down, and they're like, "Oh my God, you took that tweet down." I'm like, "Yeah, because I made a typo. You shit on me for that. I'm going to take the tweet down and retweet it, whatever." People are so aggressive. It's like, oh God.
I did an interview today that's going to go up in about a month or so with a guy, a British researcher that's written a book about spite. And he is going deep into how spite has taken over, and that spite is a behavior that is associated with anger and envy. So people feel anger and envy, and they act out in spite. And it's one of the most primitive, awful impulses that humans have. And because of the algorithms on social media, there's no ability to moderate or regulate spite. Spite becomes highly rewarded. It signals to a tribe. What are you looking up there?
I'm looking up your tweet. Do you want to see it?
Yeah.
There we are.
Dr.
See,
Gandhi.
Okay, so here it is.
There it is, yeah.
Does the risk of a blood clot outweigh the risk of getting COVID? Okay, now 283 replies, I'm afraid to look.
Yeah, I don't.
But it's very, the question is, I guess now if you're on birth control, which we just found today in this show, that might be an issue if you're on birth control, that you could get blood clots from this particular vaccine.
Yes.
But whoa, I can't wait to see.
But she also mentioned that's the data that she talked about, the 9 with 5 zeros, 0.00009% risk. And she was saying when you and I think people would appreciate when you put the risk up that way, you sort of get a sense of that when I get a clot, a bruised eye, the probability of it just being a bruised eye, some sort of random weird coincidence, is higher than the probability of a clot like that. So there you go.
How do you see these freaking comments? It won't let me get the
You
comment.
want to see them? You really want to see them?
It's not.
No. You just discarded the tweet. Oh.
No, I discarded my response. Oh, here it is.
Okay.
It just adds to hysteria. I imagine birth controls have a higher risk. Thank you, Diane Wagoner.
Isn't Diana from our Restream?
Are you out there? Yeah, this isn't bad. They're not saying, you're such a dick, Dr. Drew.
Okay.
How could you be so mean? Oh, good. That's good.
Marlise, it was birth control and not hormone replacement therapy, perhaps because it was mostly younger women, but it was all birth control as far as we can tell. But that data is not published yet. So,
yeah, I think birth
really
control,
hard,
if you smoke and you take birth control, you can get the same problem, right? Blood clots and stuff.
Correct. In fact, it's somewhat higher. But this is different. This is an antiphospholipid-mediated platelet adhesion phenomenon that's different than the activation of the clotting system. This is a different phenomenon, and that's what makes it a little more treacherous. It's just different, harder to treat. But it's the same phenomenon that we see in COVID, right? You hear that the anticoagulants aren't working and the people have clotting. It's the same thing as the COVID. Yeah. And this is back to Leopold's note, which is this spike protein response has all kinds of weird protein aspects to it. Which, again, if you're a conspiracy theorist, people go, oh, somebody designed that, blah, blah, blah. I don't know.
It's a communist plot.
Dr. Drew Strikes Back. It ends here, the sequel. Okay. I think we should wrap things up.
This is going to be the segment at the end, Dr. Drew Strikes Back?
No, I think it's going to be a general
let's put that up.
Way of being.
I'm going to put it up on the screen.
Yeah, here's how you guys can help me. This is what we do over at After Dark. Send me some logos for Dr. Drew Strikes Back. I mean, me in a Darth Vader helmet or something. I think you're onto something there. I know we have talent all over the place listening to this thing. So give me a logo for Dr. Drew Strikes Back that we could then put on another mug that goes with the Rational Revolution. So think Empire Strikes Back meets Lenin. And I think you'll get right in the right zone. If your brain can do that. Or Mao, you can use Mao meets Darth Vader. Something in that zone will sort of be the Strike Back meets Rational Revolution and could be a new mug. So
I think it should be a segment at the end of each show where you just go off on something.
Oh, like it really grinds my gears? Like Peter Griffin?
You could, a tweet that pissed you off, or hurt your feelings.
That's pretty easy to find. Let's just pick one right now, shall we?
Well, what about the C word guy?
No.
And I don't mean that kind of C word.
The C word guy.
Yeah, the guy whose name starts with C. He had a talk show.
Oh yeah, I like him. That's the problem.
I know, but he doesn't like you.
Conan said some nasty stuff that hurt because I really have.
You never went back, so maybe he didn't like you then. I remember when you were on the show, he used to always tell you that you were too depressing because it was a comedy show and they bring you on and you were like talking about
that's true
addiction and blah blah blah, and he goes, "Oh my God, this is
that's
so
true." Maybe he's talking about how many apples a day to get me away. That's what he's sort of talking about. Maybe that's sort of always been his thing.
He might have been joking, but
might have been.
We're so sensitive right now.
Yeah. Here's my. Let me just say, am I looking at the right camera? I'm all lost here.
Yeah.
So here's one thing for me. So I interviewed this guy about spite. Now, one of the things that grinds my gears is when peers act out in hostile and aggressive ways in Twitter, and particularly when they respond to fake news and don't even read the underlying tweets to which they're responding in order to get the gratification of the crowd. So my way to solve that is, much like Dr. Gandhi and I were talking, I reach out to my peers when that happens. I reach out and go, hey, let's get on the same page here.
You email them.
I email them, I call them, and if we can get on the same page, just the way we do, that's the sort of the collegial thing to do. We get on the same page.
Mm-hmm. What happens when you do that?
They won't talk to me. And what the spite researcher said is the reason is there's all this fMRI data that shows that people act out on people in social media, and the part of the brain in the fMRI scanner that's associated with object, not live being, is activated. So literally you're treating me as an object. And by me reaching out and wanting to be a colleague and find a common ground with you, I become a human being, and that makes you feel shame and guilt. And that's why you won't do it. And let's call it what that is. That's cowardice. That's cowardice. I harbor nothing in my heart of ill to these physicians. That's why I want to find a collegial, sort of way of dealing with things. It's cowardice to not have a relationship because, God forbid, you might feel a little shame and guilt for having acted out in a way that was inappropriate. It's okay. It's all right. I don't blame you. And by the way, some of these people have had really serious trouble with people calling them and hounding them and stuff like that.
Yeah, because they're assholes on the internet.
No. That is not me, and it's cowardice not to take my calls. And weird and non-collegial, too. And weird.
They're just trying to get more people to follow them by saying mean things to you on Twitter and acting like a doctor. Because they feel, I don't care. Because they get so many likes when they say something mean about you.
Fine.
Even the C word guy.
That's fine. But we have responsibility.
But he was maybe joking too.
Yeah, I know.
So.
As members of the same profession,
hoping.
to get it together,
and not
funny. We never did ad hominem attacks when we just had intellectual disagreements. We hammer out our intellectual disagreements, and most of these guys I agree with. I'm on the exact same page with, and they're acting out as though I'm different or not, and that can be one of two things. That can be spite and envy, which okay,
I think,
or just pure intent to harm, which is, I would like to not put you in that camp because that's a liability now. Now that's true libel. That's true libel, and I don't want anybody to be accused of that. I'd like to form a collegial relationship where none of that is involved. So there you go.
I like that, Leopold. Susan, if it bleeds, it leads. Conflict sells. Sometimes bad press is good press. It keeps you present.
Well, as Valerie Allen, our great publicist, told me 2 years ago, in the days of a Trump presidency, if you're not in a shitstorm, you don't exist. And I thought, she's onto something. I think that's right.
But then she didn't want us to tweet anymore.
Yeah, well, even she couldn't handle it. So here we go.
We shoot all our people away. Nobody wants to be around us anymore. But you know what? It's a new dawn. It's a new day. We're gonna find your new beginning with your big black eye. We're gonna get you your photo on the RCA Victor banner with a big black eye.
No one knows what you're talking about except me. That's hysterical. That's fantastic.
Like the cute dog will just perch you up.
Yes.
He's the old guy, isn't he cute?
All right, let's wrap this up.
I'll be waving off the sides of I'm going to be waving from the side of a cruise ship with my finger up in the air. Bye-bye, everybody.
Oh, your middle finger up in the air.
It'll definitely be forgotten. Yes.
Good. In the meantime, thank you, Tom Cigar, for the Drew Strikes Back. Let's see if we can get some logo to come with this segment. And we will see everyone.
I like this idea.
Yeah. We will see everyone tomorrow. Taking calls. So tomorrow will be about you guys, and we'll see you then.
God bless you.
This pandemic began, we were not sure how it spread. Everyone began wearing masks and using hand sanitizers. Great ways to slow the spread. but a lot of people still get sick. I can personally attest to that. We now know that COVID-19 spreads via aerosols and droplets from the nose and mouth, and I've been thinking about this for a while. Why aren't we also sanitizing the nose and mouth, killing the virus directly at the place where it spreads? Why weren't more doctors thinking about this? Well, some doctors have done the research. Wish I discovered it sooner. That's why I'm excited to tell you about Hydrolyte. It's an FDA-registered antiseptic for the nose and mouth that's proven to eliminate 99.99% of the virus that causes COVID-19 in just 15 seconds. That's right. It's created by a team of clinicians with decades of experience in antiviral treatments, initially created to protect healthcare workers. These are smart scientists, and it's a great product that also eliminates many other viruses and infecting particles. I'm using both their nasal antiseptic swab and their oral spray to help protect those around me, and you should be too. For others and for yourself. Whether you're hopping on a 3-hour flight, always use it there, visiting grandparents, or attending a meeting that you can't miss, Halodyne's family of oral and nasal antiseptics give you the safe, easy, on-the-go antiviral protection for up to 4 hours. I encourage you to try Halodyne at halodyne.com today. My listeners get 10% off with the discount code Dr. Drew. That is HALODINE.com, discount code DRDREW. So obvious, it just makes sense. Stop the virus before it spreads and gets in your body with Halodyne.
Anyone who's watched me over the years knows that I'm obsessed with Hydrolyte. In my opinion, the best oral rehydration product on the market. I literally use it every day. My family uses it. When I had COVID, I'm telling you, Hydrolyte contributed to my recovery, kept me hydrated. Now, with things finally reopening back around the country, the potential exposure to the common cold is always around. And like always, Hydrolyte has got your back. Hydrolyte Plus Immunity, my new favorite, starts with their fast-absorbing electrolytes and adds a host of great ingredients. Plus, each single serving easy pour drink mix contains 1,000 milligrams of vitamin C, 300 milligrams of elderberry extract. Hydrolyte Plus Immunity comes in convenient, easy to pour sticks that rapidly dissolve in water, make a great tasting drink, has 75% less sugar than your typical sports drink. It uses all natural flavors, gluten-free, dairy-free, caffeine-free, non-GMO, and even vegan. Hydrolyte Plus Immunity is also now available in ready-to-drink bottles at the Walmart next to the pharmacy, or as always, you can find it by visiting hydrolyte.com/Dr. Drew. Again, that is HYDRALYTE.com/DRDREW. Be sure to use the code Dr. Drew 25 for a special discount.